Welcome, everyone. Good morning and good evening in Europe and India. 70 million people around the world suffer from vitiligo, a condition in which the skin loses its pigment cells. Can natural therapies help with management and treatment? We are going to explore how Ayurveda can demonstrate success outcomes. I am Amita from Nourishtalk, a platform for natural, holistic, and integrative therapies. Presenting this topic, we have Vaidya Sneha Rathi, who has treated over 3,000 cases of vitiligo with excellent success rates. She is also actively involved in different awareness workshops through national newspapers, different NGOs. In addition, she has presented her research and clinical work at international conferences. Recently, she has been awarded the prestigious Dhanvantri Sanman Award and an Ayurveda Award in India. Welcome, Dr. Sneha.
Thank you. Hello, Amita. It's a pleasure to be here in Nourishtalk. And thank you for inviting me to this session.
Great. Such an amazing work that you have done. It's fascinating. And I think it can help so many people. So let's start with a brief overview of cause of vitiligo.
Yeah. Namaste to all my friends and viewers in USA, India, and all other countries. We are here to discuss about vitiligo, which is a cosmetic issue rather than a health issue. Every human being is beauty conscious. If one has vitiligo, he or she feels depressed. The person is not ready to accept it. It emotionally affects their life and has great social stigma. In vitiligo, there are white patches on skin due to loss of melanin, means color pigments, which are responsible for the skin color. Though vitiligo does not affect any internal organs, but the society is not ready to accept them freely, especially for girls. It's very pity to say, but they have problems in their marriage in India. Vitiligo is non-contagious and is very stressful for the patients. That's why I always call it that vitiligo is a mentally disturbing stubborn skin disease. Now, let's understand what is vitiligo. Vitiligo is a condition in which the pigments are lost from areas of the skin, causing whitish patch on the skin. It is due to abnormality of melanin-producing cells called melanocytes. The white patches often change shape, shrink, or go. The extent and rate of color loss from vitiligo is unpredictable, but it usually appears on sun-exposed areas such as hands, feet, arms, face, and lips. It can affect any skin type or any part of the body, including hair, as well as the tissues, that is mucous membranes, that lines the inside part of the mouth, nose, genital, and rectal area, and the retina of the eyes. So generally, it affects 1 to 1.5% of the world population. But in India, it's a bit high. It's around 1.5 to 2% of population. Vitiligo affects all races and both sex, male and female, equally. And maximum cases are seen below the age of 40. Generally, the ratio is high between 10 to 40 age group. Are you getting, Amita?
Yes. Should we move to the next slide?
Yeah.
You tell me.
Yeah, symptoms.
Yes.
Okay, causes and pathophysiology of vitiligo. Now let's discuss about it. The precise cause of vitiligo is complex and not fully understood. Still, some causes are responsible for vitiligo. Normally, single cause may not lead to vitiligo, but in combinations or multiple causative factors are attributable for vitiligo. Among them, genetic. Genetic causes one of the main cause. It is 30% hereditary. Mostly, it passes to third generation. Another cause is hormonal cause. Some hormones are responsible for vitiligo, like melanocyte stimulating hormone, thyroid hormone. Imbalance of these hormones may lead to vitiligo. Next cause is autoimmune disease, a condition whereby the immune system of body destroys its own tissues and cells. Some diseases like Hashimoto's, pernicious anemia, alopecia are related to vitiligo. The important one is food related. In Ayurveda, we believe that there is a great role of diet in the causative factor and also treatment of this problem. In Ayurveda, it has been said that certain food articles are never to be consumed together while eating. That can cause harmful effects to your body. Thus said to be viruddhahar. Viruddhahar meaning opposite food combination, that is incompatibility of food, like fish and milk, hot water with honey, milk with sour fruits, yogurt, non-veg, and many more. These are opposite food combinations which taken together can produce toxins in our body. The next general cause, but important one, is stress. Lots of stress may lead to oxidative stress, which can turn into free radicals. That will decrease your immunity and can cause vitiligo. Another cause is worm infestations. Generally, in kids, there is history of worm infestations, which may proliferate vitiligo. The next cause is heavy doses of medicines. Medicines like antibiotics, steroids, antihistamines taken for longer period can be one of the cause of vitiligo. Apart from this, vitamin B deficiency, vitamin D deficiency, even serum copper deficiency, iron deficiency are the causes of vitiligo. Now, we will understand pathophysiology of vitiligo. According to modern science, there are different theories like oxidative stress, autoimmune mechanism, cytotoxic mechanism, neural mechanism, by which progressive loss of melanocytes or stoppage of melanocyte production is seen, leading vitiligo. Next slide.
Yes, let's move on. So we'll talk about what was the Ayurveda perspective on vitiligo.
Yeah. Vitiligo in Ayurveda, my subject. Yes. According to Ayurveda, vitiligo is known as Shvitra. Pathophysiology of vitiligo, I'll explain in the chart form first, but let's understand physiology of Ayurveda. As Ayurveda is vast subject, I will explain in short, otherwise it will take very long time. Vata, Pitta, Kapha, collectively known as three dosha, and they each have 5 subdoshas, which are the main constituents of the body. There are 7 dhatus and 13 strotas in our body. Nidan Sevan, because of excessive viruddha ahar and change of lifestyle, there is Agni Mandya, that means poor digestion is seen. Because of poor digestion, amotpatti is created, that is accumulation of toxins is seen, which prakops sharirik and mansik dosha, means tridosh gets vitiated. And this prakop vitiates bhrajaka pitta, one of the subdosh of pitta. Hence, raktava strutas dushti, one among 13 gets vitiated, and medadhatu dushti, means all the 4 dhatus among 7, naming rasa, rakta, mans, and med gets vitiated. This phenomena takes place in the skin, that is tvachasthan sanshray, which creates twak vaivaranyata, means discoloration of skin, leading to shvitra. Next slide, Amita.
Okay.
Yeah. A treatment of shvitra in Ayurveda. Treatment is given to pacify the imbalanced body energies, cleanse the body, and restore its color. Ayurveda considers poor digestion to be the main root cause of this disease. Improper digestion causes the build-up toxins in the tissues and blood. This leads to depigmentation. So the most important part of Ayurvedic treatment is to restore digestion. So the most important part of Ayurvedic treatment is to restore digestion by following diet regulation and lifestyle guidelines. In addition to this, proper assessment of the causative factor is also important. That should be managed by appropriate Ayurvedic treatment. That's why Ayurvedic treatment of white patches is based on improvement of immunity and rectification of the problem from root. Yeah. Next.
All right. So let's talk about the few of the success stories out of 3,000 success stories you've done. It's very impressive.
Yeah. Yes. A small kid of 4 years came to us with hypopigmented patches on her face, hands, legs, almost all parts of her body. You can see her face. The symptoms were white pinkish patches, No itching was there. Pitta and Kapha Dushti was clearly seen. Next.
Yes.
History. When we took his history, we came to know of some points, like there was no family history, was having cold and cough frequently, severe constipation. She was passing hard stool after every 2 to 3 days. Worm infestation was there. At the age of 2.5 years, her parents noticed small patch on eyelid. They went to dermatologist and was diagnosed vitiligo. She was prescribed Melgen lotion. Initially, it gave results, but after some time, it relapsed again. They started treatment by another dermatologist, but none of them medicines worked. In fact, it increased a lot. Yeah, next one. After, see, what we planned the treatment, after proper evaluation, we decided to detox her body by Virechana. Virechana is one of the Panchakarma process, which means cleaning the gut by purgation, that is by loose motion. So Virechana was done by Abhayadi Moda. After proper gut cleaning, treatment for vitiligo was planned. Shvitrahar tablet was especially prepared according to her Prakriti age. She was small baby, so we have to plan that tablet very in precise form. Along with this Krumigna tablet, Mahamanjishta the Kwat, Arogyavardhini Bati was given. Yeah, next one. See, after 2 months, you can see hyperpigmentations on her foreheads. And after 4 months of the treatment, almost her face has been cleared, except eyes and lips. After 9 months, you can see the improvements. And after 12 months, it is like, if you compare it.
Yeah, she's a normal baby. She's a normal baby now.
Right. So she, all the white patches has been vanished, and she is under treatment, but the patches have been completely, they have gone.
Okay, this is fascinating. It's absolutely fascinating. So this is the overall during the treatment.
First day 1 and after 12 months, you can compare after day 1 directly by the 12-month baby. So 12 months improvement. So you can see the difference. So yeah.
Okay, so let's move on to another case, and we'll take the questions. She has a brief presentation. We'll take questions very soon.
Yeah. A male patient of 65 years came to us with hypopigmented patch on scalp since last 4 years. Symptoms: no itching, but sometimes itchy if bareheaded when more exposure to sun. He was a farmer, so he has to work on bareheaded. So when he was going bareheaded, he was having itchy. Patches were pinkish, red in appearance. Yeah, the next one. History. No family history was there. He was hypertensive and suffering from Hashimoto's disease from last, having history of constipation. As he saw the hypopigmented patch on his scalp, he went to dermatologist and was prescribed Momet cream for local application and Suralin tablet. He didn't get any response. He then switched to 3 to 4 another dermatologists in last 4 years, but all treatment went in vain and it kept on spreading. Yeah. This was the treatment plan. We have done it. That we prescribed Gandhak Rasayan, Arogyavardhini Bati, Shvitrahar powder, Manjishta, in Shvitrahar powder, Bakuchi, Manjishta, Khadir, Chitrak, Shvitrahar oil, Trifla Gutika, Keshor Gugul was planned. So after 3 months, you can see the improvements. There are small, the patches has been reduced and small hyper pigmentations is seen. And after 8 months, all this white patch has been vanished. Yeah. Now day 1, yeah, it is typing mistake Amita. After 2 months, it has written like that. So it is it's day 1 after 3 months and after 8 months.
Okay, so no problem.
Yeah, you can
so typically takes about 8 to 12 months for a person to get relief from vitiligo?
Results will be seen in 2 to 3 months initially, and after that depends on the patient's body constituents, prakriti, age, like that way.
Okay. So that's all right. So let's talk about another case of a lady.
Yeah. A lady of 32 years came to our clinic with hypopigmented patches on neck. She was suffering from last 3 years. Pale, pinkish patches were seen with clear borderline. Yeah. Her grandfather was having vitiligo. Here the genetic history reveals. First patch was seen after her postpartum, after her first delivery. She took too much viruddha, incompatible food, in her pregnancy period. Initially, she ignored the patch as there was itching. She thought it's because of she had itched a lot, but slowly it started increasing. Then she consulted a dermatologist and was diagnosed vitiligo. She was given fluate cream and tacrolimus ointment for local application. No oral medicines were given as she was breastfeeding. After seeing no improvements for longer period, she was prescribed steroids, but she started gaining weight. So she stopped all the treatment. Then she took some home remedies suggested by one of her aunt. Yeah. We planned, because as her Pitta Dushti was higher side, so we planned Kamdudharas, Arogyavardhini Bhati, Shvitrahar powder, Shvitrahar oil, Trifla Gutika, Manjishtavan Bhati. Yeah. So this way we planned the treatment, and even modified after some improvements were seen. Yeah, next slide. After 2 months, there were hyperpigmentation patches. You can see small dot. And after 5 months, almost the patch has been covered, but still hyperpigmented patches. White patches are, we can see very minute white patches.
Yeah.
And after completion of the treatment, there is no patch, everything is cleared.
This is amazing work. Dr. Sneha, this is amazing work.
See, day 1, after 2 months, and after 9 months, this patient is, since we can see, compare by the first patch and after 9 months.
Yes.
Yeah. So discussion on the treatment. From last 16 years, I'm exclusively practicing vitiligo. I give self-prepared medicines to my patients according to age, bal, prakriti, dosh, dushya, samorchana, and modify the medicines according to the patient's response. After proper examining, the patient is given various herbal combinations to remove the toxins from intestinal tract for proper digestion of food and improves the absorption of medicine, essential vitamins and minerals, purifies the blood and stops the disease from spreading, works on manohar srotas for relieving stress, regularized vitiated dosh in body that is responsible for spreading the disease, strengthens the immune system. If we say, according to Ayurveda terminology, Agnimandya and Amutpatti is corrected so that vitiated doshas comes in samabhava. For this, Arogyavardhini Bhati, Trifla Gutika, Kamdudharas, Shvitrahar powder are planned. Raktavas Srutas Dushti is corrected by Rakta Prasadak and Rakta Shodhan medicines. For this, Gandhak Rasayan, Manjishtaghan, Nim powder is planned. Manshik Prashaman is also required because these people have stress, too much stress about this disease. So some medicines are selected to correct the Manohar Srutas, Malkangni, Brahmani, etc. are planned. Rasayan Chikitsa is given to strengthen the immunity. For this, Bhalladak Rasayan, Giloe, Chitrak are planned. So this way, we plan our treatment, administrating proper set of medicines according to dosh, dushya, samorchana and the patient, sincerely following all the instructions gives very good results and chances of relapse are almost nil. Thank you.
That's great. So we open it up for questions because I see questions coming up. And then, okay, so there is someone who's asking, they're saying, you said hot water with honey is virud ahar, but in present time, this is recommended by every physician in weight management. Can you please explain it?
I was expecting this question because nowadays it is very common practice. But in Ayurveda, it is mentioned hot water and this honey, both are viruddha. But by taking from, if we take it from this childhood, so it will get satmya. What you will say is it will be body will inculcate that habit, and the toxins will be definitely they will produce toxins, but the thing will be in slow form. So it, according to Ayurveda, it is wrong, but still we people believe Ayurvedically, and modern physicians or dietitians believe accordingly modern science. So according to them, for weight reduction, it is a good thing. But if we talk on the part of amotpatti or toxins, then it is a wrong thing.
I see. So someone's saying, someone's asking another question regarding the genetic history. What does the research and your clinical experience show is the chance of children receiving this vitiligo gene that can turn on at some point in their lifetime?
Yeah. See, genetic history, I have dealt with many of genetic history cases. Okay. So till date, none of the case has relapsed, because Ayurveda treats by root cause. Though it will be there in the genes, but still the root, Ayurveda will treat by the root cause. Means if he or she follows properly the diet regulations, after that means follow the cross food. If he or she will not do the cross foods, he will not consume the cross foods, then there will be, and if he will be in a proper lifestyle, then there will be chances that it won't relapse, and genetic history, it won't relapse it. So because if there is genetic history, still the patients are getting very good results and it is cured.
Okay.
But it still depends on the site.
Sure. Someone is asking, my daughter's having white patches on her head with white hair. I am really worried whether it can cure or not.
Scalp is very easy to treat, and
okay.
the question about and the question about white hair, I have seen some cases after getting, I mean, that patch is cleared, that white patch is cleared, after some time that white hair also turns it into black hair, because we create melanin. Our treatment do is, the cells which are melanocyte cells which are not producing melanin, we enhance that melanocyte function. So
okay.
So melanin is formed is in the proper way, and in the purest way, you can say, according to Ayurveda.
So if you have, this person wants a consultation, you can email us, care@nourishtalk.com. I took the share slides out because I want you to have a dialogue with Dr. Sneha. So please feel free to reach us at care@nourishtalk. All right, so we have a lot of questions coming up. I think you're going to be very busy today. Someone's asking, can
vitiligo is a subject like that I all have many queries. I'm used to.
Oh, good. So can Langhan help in vitiligo? I think Langhan is one of the therapies in Ayurveda. Yes.
Langhan can help, but first of all, you have to detox your body. There are many procedures, but still Langhan definitely will help, but only Langhan will not help.
Yeah.
You have to take treatment also.
Correct. Someone's asking, are there specific foods to avoid? You talked about the incompatibility of the food combination, right?
For vitiligo, we have diet restrictions. Because, like milk products, non-veg, seafoods, eggs, difficult to digest. All this I will stop, but still we have to stop, because according to Ayurveda, these foodstuffs are Guru Ahar, and Guru Ahar will slow down your digestion, means Agniman they will create, and Amotpati, and resulting to vitiligo. That is why only this diet restriction is till the treatment is going on. After that, during treatment, I allow each and everything, depends on the improvements.
And I want to say that we'll be bringing Dr. Sneha back for a group workshop, which it will be longer. Today is a condensed version, where people who are suffering from vitiligo or any kids or anything, they can ask her all the questions. So it'll be a 2-hour workshop. We'll be bringing it and letting.
Sure, sure.
Yes. Someone's asking, does vaccination cause vitiligo in kids?
No, I haven't seen yet. That,
okay.
Because of vaccination, there is vitiligo. If there is scar injury and that leads to vitiligo, that is another thing. But because of vaccination, it's difficult. Okay. It's not like that.
Okay. Someone's asking, does the patch appear back? I think what they mean is that it comes back.
Relapse.
Is there any relapse once it's gone after using it?
Yeah. See, if they do proper root cause treatment, the relapse rate is very, very negligible. Mm-hmm. So, but they have to follow all the diet regulations, and they have to follow all the lifestyle, whatever has mentioned to them till the treatment, and after the treatment also they have to follow, they have to live in a disciplined life.
Sure. Okay, someone's asking, we have a lot of questions, Dr. Is your treatment compatible with narrow UVB light treatment?
In my treatment, no need of narrow UV radiations, because I tell them to take sun exposure. So that works with like that only. So when we get free sunlight freely, and one thing is positive in sunlight, that we get vitamin D, which is required naturally, which is required for repigmentation of the patches. So why to take UVB along with our treatment? No need of it.
Okay. All right. So what's the treatment for non-recurrence of vitiligo after treatment, and which rasayana to be used?
Within the treatment we give, and then bhallatak rasayan, chitrak rasayan, depends on the prakruti, depends on the case, depends on the how he and at which age he has responded. Like that, we will decide.
Okay. Sure. Should we follow? So someone, I think, who's suffering from vitiligo right now, they're asking, should we follow the diet for lifelong? You know, the diet is.
No, earlier I have mentioned it has not to be followed lifelong, only till the treatment.
Okay. Someone's asking, would working with a local Ayurvedic practitioner be recommended, or do you work remotely with patients? Can you take Skype, Zoom calls?
Yeah, I do online patients, and I do Skype, video call, everything.
Okay. So this you can reach us, and we can put you in touch with Dr. Sneha. You know, she's. I don't know. I don't know where you are from. If you are in US, you know, Ayurveda is used only for wellness.
Right.
So for this treatment type of thing, I think Indian doctors have been trained very well in India.
Yes.
So I just wanted to make a comment. So then how are your results on the back of the hand and feet? Someone who's suffering from on the hands and the feet, have you done those kind of things?
Difficult to treat. I'm very frankly, I'm very openly, I say that it is difficult to treat. But slow, definitely results are there, but very, very slow and difficult to treat.
Okay. So, but there is hope, right? We want to give some
there
hope.
There is hope.
It might take longer. It might take longer.
It might take longer.
Okay.
And there is hope.
Okay. So we have what can vaccine? I think somebody asked this question earlier. Can vaccination cause vitiligo in kids?
Yeah.
You answered that.
Yeah, I answered that.
Okay. So what foods are recommended to treat vitiligo? This is a topic by itself, but maybe you can give a brief overview. I think we're going to have a long session.
Yeah.
With Dr.
Yeah, it is a vast topic, but still, chickpeas, copper whistle water, walnut, figs, carrot. These things are to be taken a lot. That can control, help to repigmentation, help for repigmentation.
Yeah. Somebody's asking, what is the recovery of vitiligo in girls' genital parts? Have you seen those kind of cases?
Yeah, and very nicely, the results are very excellent.
Okay. So whoever's asking this question, you know, there's a lot of hope. Yeah, I think you can consult with her. That would be good. Okay, let's see. How long does it take for head and hair part to cure in kids? You,
See, the results will be seen within 2 to 3 months. Still, without seeing the case or without looking at the patches, it's very difficult to say everything, because still when we see the patients, image comes to in our body, like which prakriti he belongs or she belongs, what are the sites and all, what are the patch colors, and after that we decide. And but still, results will be coming in 2 or 3 months.
okay. Yeah, that's what you shared with most of the cases, that initial results, you have to be patient. It comes in 2 to 3 months. All right. So let's see what are the, okay. So we have, okay, do the patches on the fingertips, when, the fingertips, I think someone must have
Yeah.
it. What is your experience on treatment of the
Still
fingertips?
same thing, difficult on hand, like that way I have answered that it is difficult to treat. Fingertips, some sites are there which are difficult to treat, especially lip tip ends are difficult to treat, like lips, fingertips, these are difficult to treat.
Sure, sure. I think this is a doctor who's asking a question. Can we use Udayati, Udayati,
If
Udayati
we get it,
Rasa?
I don't use, because that is Pitta Prakriti, means Pitta Vardhak medicine. But still, if he gets result, he can use it.
Okay. Somebody's making a comment. I think he's a doctor. He's saying bloodletting by leech can help. In your experience, do you think so?
Yeah, they can help, but to some extent, because earlier I used to use it, but I didn't get very good results. So it depends.
Okay. And then I think this is another doctor asking, can Pancha Tikta Google, Gruta Google can help in this or not?
That will help to just only to correct all the different measures, like if he is having other that dosh dushya dushti, then it will help, not to particular on vitiligo.
So, we can have a separate session for doctors as well. I think I see a mixture of doctors and
Yes.
clients. So
Yeah.
if doctors want a separate session, we can have a Dr. Sneha come in and do a session for doctors to doctors, and the one would be for the end users, who actually have issues.
Right.
All right. So honey is bitter in taste and water is madhur. I don't know what that means. Somebody's asking this question. Comment, I think. All right. Let's see. Okay.
That is a comment, I think, because that is
Yes.
Yeah.
Yeah. So someone is asking that, have you tried your own Ayurvedic treatment on yourself? Did you? I don't.
Why I am a
Yeah.
doctor, so I
Yeah.
treat.
Yeah. No, I don't think so. I think this comment is that no, she does not have vitiligo at all. I think maybe you're looking at my face. I'm sitting in the sunlight is coming, so that's why you're seeing my face. My face in a little bit different. So no, the answer is no. All right. So how long your treatment has to be taken in kids? What if it relapses after stopping the treatment?
Till date, relapse rates are very, very negligible, but the treatment has to be continued for 20 to 22 months. Depends on the response of the patient.
Okay. Someone's asking, can tomatoes be consumed?
Yes, I allow tomatoes, only cooked one, not raw one.
Not the raw one, not the raw one.
Yeah.
Okay. So someone's asking, I think this is a doctor asking that it can vitiligo be cured by oral medication only, or local application is must?
Both are required.
Both,
Not only
both,
local,
both.
yeah, not only local or not only oral will work. Both are required.
Both are required. Okay, someone's asking, my son's eyelashes turned white on right side.
Mm-hmm.
Has doctors, have you seen something like that on the eyelids? I think you talked about that.
I have treated many eyelids cases, but especially talking about the eyelashes, it will take longer time to correct that eyelash, but the patch will go away. But lash, particularly I'm talking about lash will take time, but patch will go
eyelashes is correct. Eyelid was different and eyelash is different.
Yeah.
Correct. I think this is a doctor asking a question. What do you use for detoxification? It's up to you how much detail you want to go in.
See, every time it is different. It's not fixed for each and every patient. Again, every time we see the Prakriti, age, bal, dosh, dushya, kal, every time, matra, then we decide what matra. Still preferable, I give Abhayadi Modak. Depends.
Okay, so someone's asking, I think it's a US client. They are saying the shipping cost can be very expensive. Would you consider creating a shipping center here in the US, so it would be easier and cheaper to ship to patients in the US? We are in US, by the way. Nourish Talk is a US-based company, and we are representing Dr. Sneha Rathi here.
Yeah.
So you can consult with her. We are here to help you, so don't worry about that. So you know, the answer is that we are here on Dr. Sneha's behalf and on clients' behalf in US. So, right. so I don't think you should be concerned about that. If you want to consult, like I said, please reach out to us here at nourishtalk.com. And you, so that's the thing. All right. So someone's asking, do we? My God, there's a okay. Sorry. Do we have to do deworming for kids?
In our treatment, we do that. Not specially apart from our treatment, you have to do special something. We take care of that thing. We do deworming, and whatever is there, it is present in our treatment.
Okay. Someone's asking, can you treat someone in Oman? Let me write down. Someone's asking, I think you can treat anywhere, right, in the world?
Yeah, I can treat anywhere in the world.
Okay, so I'm putting down our email, care@nourishtalk.com. All right, and www, because someone's asking, please let us know the address. So this is our website. You can email us at care@nourishtalk.com, and then based on your, we will recommend, we will pass you on to Dr. Sneha. I think it would be an initial consultation, if I'm not mistaken, followed by the treatment, right, Dr. Sneha?
Yes.
All right. Okay, so we are, Nourish Talk is in US, as I said, and Dr. Sneha is in India, but we can administer this process. All right, and okay, how do we identify new spots coming up?
See, wherever you are, you have to first confirm it by a dermatologist, proper local dermatologist. Then and then only we can decide. He will examine by Wood's lamp. It is a very good thing. By that, if it is vitiligo, it can be clearly seen. So,
okay.
Yeah.
All right. Someone's asking, do you recommend a gluten-free diet during treatment? I hear that often.
Not necessary. I don't recommend.
Okay.
Because Ayurveda medicines are such a good thing. They take care of all the things.
And they're mainly herbal medicines, right?
Pure herbal medicines.
Pure herbal medicine. Okay.
Prepared by us, so no problem in that.
Okay, and no metals and nothing.
No, nothing.
Okay, so this person who's asking, I think you have someone who's suffering from vitiligo. Herbal medicines are safe, and they don't put any elements at all. So you should be fine. Okay, are there any side effects of your medicine?
No, not yet.
Okay, all right. What is the monthly cost of treatment? Well, we can, whoever is asking this question, if you can send us an email, I think it will depend on the case-by-case basis.
Yes.
And we can let you know the cost as well, because I think she has to, what I understand, you have to take the first consultation, right?
Yeah, first analysis the case, and after that we have to decide it.
Okay, yes. So let us know, and we can direct you, and she can tell you based on the initial consultation, right? Okay. So then someone's saying, can we consume homemade brownies, cakes with wheat flour, or jowar as maida is not advised?
See, if my treatment is started, then you have to follow all the diet regulations.
Of course. You can't just start
on the treatment, then no need of that diet controlling and all, because every person or every doctor will suggest some different diet.
Yes, absolutely. Okay. Are there any side effects of your medicine in younger kids? You said that.
No, not at all.
All right. So someone's making a comment. We have spoken to our friends taking treatment from other doctors, but the food restrictions are conflicting from doctor to doctor. Well, all we can say is Dr. Sneha has treated over 3,000 cases. So the proof is in the pudding, right? She has successful outcomes, so many clients. All right. Is paneer allowed to consume?
In my treatment, it is not allowed.
Okay, it's not allowed.
No.
All right. I am just going through if I have missed any other questions. All right. Oh my God, this is a very strange question, Dr. Sneha. Have you ever used cow urine for internal use for any treatment?
No, not till date. But some people say that it is effective, but I haven't used it.
Okay. All right. So I think this client is from US. She's asking, your diet recommendations, do they stay the same for every patient or are they based on your initial consultation and individual?
Some part is same and some are different. Depends
So
on the patches and all. Yeah.
Okay. Okay. All right. So someone's asking, is radish good for vitiligo? Can I consume daily?
No.
Wow.
Not.
Okay. Okay. So I think there are a lot of diet questions that are coming
Yeah.
up. We will.
Because the subject is Ayurveda, na? So people
Yes.
ask vitiligo diet
Yes.
a lot.
So yeah, so we will, this is great. We want so much engagement when we do the webinars. I mean, this is really amazing. People are asking so many questions.
Right.
It's really great. It tells us that, our sessions are successful with
Yes,
the success outcomes as well, like Dr. Sneha's. All right. Yeast-free whole bread, is that allowed?
Yeah, allowed.
Okay.
If it is yeast-free, then it is allowed.
Okay. Any Devya Chikitsa you recommend? What is Devya Chikitsa? I don't know what that is. Divya.
Divya Chikitsa, no.
No?
It is for Ramdev Baba they are talking about. No.
Okay. How do you contact Dr. Rathi on nourishtalk.com? Care. I had put down our email, care@nourishtalk.com. You send us the email and you can reference this particular webinar. My name is Amita. You can reference my name as well. And we will put you in touch with Dr. Sneha immediately.
Sure.
Right? So I hope I've answered this question. Okay, what are the most effective herbs on vitiligo? Well,
effective herbs. See, in Charak, there are n number of herbs, but it varies again person to person. Still, like Bakuchi, Manjishta, Neem, you can say Bhallatak, Gunja, Chitrak, many are there. But still, it depends on each and every body constituent and depends on the case. What has to be given and how it has to be given.
All right, so it depends on the case. I've written my name also for all the attendees if they need to contact care@nourishtalk, and you can reference this webinar and my name. All right, okay. So now someone's asking, sodium bicarbonate and baking powder, is that allowed to consume?
Sometimes.
Sometimes, okay.
Not regularly.
All right. Can I use 1 tablespoon of tamarind paste for preparing food? Well, you have a vitiligo, I think.
Not allowed.
Not allowed. Oh,
not allowed.
Yeah, so these are, we will do a very detailed webinar, not a webinar actually, it will be a workshop. So that's where we will go through, maybe you can talk about what is allowed, what is not allowed, because these seems like a lot of questions are coming up.
A lot of confusions are there again.
Yeah, and we will let all the attendees for this webinar know when that is coming up. But right now, this is an intro session. So we want to take care of all the questions. And we have almost 5 more minutes left before we wrap up. So please, consider that. All right, so we have another question. Can we use body shop or soaps for the kids available in the market? Or should we select the organic ones, which are hard to find sometimes?
Yeah, you should use soft soaps, whether they are organics or even from market also, but they should be soft one.
For the skin, right? Yeah, for the skin.
Yeah.
Yeah, that makes sense. Someone from Singapore has joined and they're asking, is pickle allowed?
No, not allowed.
Okay. Sorry, pickle is not allowed.
Yeah, it's very difficult for me to say no, but still not allowed.
No, that's good. That's good. All right. Okay. There's a doctor. She's asking which pranayam is good for speedy recovery. Is there a particular pranayam that you?
Kapalbhati.
Kapalbhati.
Kapalbhati, definitely it will help.
Okay. So I hope you know how to do Kapalbhati, whoever has asked this question. Otherwise, you can go on the internet, check how to do Kapalbhati. In fact, we had a session on Kapalbhati. Yes. Are there any fruits or vegetables helpful in vitiligo? What
any
should
foods?
Fruit or vegetable they should focus?
Vegetables?
Yeah.
Your voice is not clear, Amita.
Okay. Can you hear? Can you hear now?
Yeah. Right. Yes, I can hear you.
Someone's asking what type of different fruit or vegetable they should have if they have vitiligo. Any particular one that you recommend?
No. Yeah, pomegranate. Pomegranate will be, they should consume much. Pomegranate, papaya.
Okay.
Yeah, they should consume it in a quantity.
Pomegranate and papaya.
Yeah.
Okay. Hope we answer this question. All right. Any other questions that I have missed out? Please let me know. There's almost like 60 questions that have come up. So I'm trying my best. Okay. Fermented foods, are they allowed, like dosa?
Sometimes. Once in a blue moon, you can say.
Okay. All right. We have to wrap up in 4 minutes, all the attendees. So vitamin B complex help, is your treatment based on Indian herbs? Are they tablets and syrups? That's a client from US, I think.
Repeat again.
So they're asking, does the vitamin B complex, does it help with the vitiligo?
Yeah, surely it will help. Surely it will help.
And your treatment is based on Indian herbs?
That's
right.
Indian herbs. Yeah.
Okay. Are they in tablets or syrups?
They are in tablets and capsule forms, both.
Okay. So hope we've answered this question. Okay, somebody's asking which date will your workshop be? 2 hours. So we haven't decided the date yet. We will decide, and we have all of your emails who have registered. We will let you know. Hopefully in September, right, Dr. Sneha, we can do it.
Yeah, can conduct.
Okay, all right. So someone is asking, 2 years ago, I consulted with a doctor. I know that the cost of sending the medicine to Poland is high. Maybe something has changed, or someone in Poland, you can cooperate with you. We can look into that in Poland as well. We have, tie-ups. But the first step would be an initial consultation with Dr. Sneha, and then after that, right, Dr. Sneha?
Right.
Okay. Someone's asking, can I consume buttermilk daily as curd is not allowed?
Yeah, buttermilk you can take. Even curd is allowed in my treatment.
Okay. Well, that's good for you. Whoever asked this question, you can have curd. What do you suggest for constipation?
Depends on the person to person. Still, there are many herbs like trifla, haritki. Yeah, there are many, but depends on the patients.
Trifla, by the way, is readily available in US. In fact, I bought it last week. It's available, online. I think you can buy
it is available. It is available.
In liquid form. It's very readily available.
Readily available.
If this client is from US, I don't know, but I'm just saying. Okay, so they are saying, did you use copper drinking for copper dishes?
Yeah, they should use it.
Copper is good.
Copper is good.
Okay. All right. Any other? Okay. I think we have to wrap up. So we will, we will let all of you know when the 2-hour workshop is, because this is an extensive topic. A comment from someone saying, wonderful presentation. Someone from US. She's commenting on your presentation. Thank you so much.
Thank you.
All right. Any other last questions before we wrap up? I live in US. How to start the treatment? We talked about
you can take care of it.
Yeah, we talked about this. What you do is please get in touch with us, care@nourishtalk.com. I had put it on the slide, but I stopped sharing because I really wanted you to see Dr. Sneha, reach out to us, care@nourishtalk.com, reference this webinar, and then we will put you in touch with Dr. Sneha, and this will start with the initial consultation. Okay, very helpful, some comment. Another one, thank you so much for building us the confidence. We'll definitely reach you. Thank you. Stress must be avoided as this will increase this. Yes, you mentioned about
stress has to be avoided.
All right. Thank you. Can you send the chart of what to eat and avoid? We recommend that you attend the 2-hour workshop, honestly, because, right, Dr. Sneha?
Yeah,
what do you think?
Sure.
Yeah, we recommend that because these would be generic, like suggestions then, and anyone can find on the internet. But with Dr. Sneha, you will exactly know. She will explain you very clearly. So we highly recommend that you follow the workshop and just be patient with us. We will be coming with the workshop very soon. Okay. Yeah. Any other final questions before I wrap up? Okay, I think we have had the maximum number of questions. I should say that in any session we have done, we have 75 questions today. I tried my best to go over each one of them. I hope I have not left anything out. Thank you so much, ma'am. Really a great session. That's a comment that's coming up. Okay. All right. So somebody's asking you, do you use Chinese herbs?
No, I don't use Chinese herbs.
She's an Ayurveda doctor. She uses Ayurveda herbs.
Ayurvedic medicines. Yeah.
Yes, Ayurvedic medicine. And these are herbs. All right. Yeah. So I think I'm going to wrap up. Any final questions from the audience before we wrap up? I want to give one more chance. All right. Okay. Okay. Well, final words from Dr. Sneha before we wrap up to our audience.
Definitely, we will go for workshop. Thank you, Amita, for inviting me. And you are doing a very good job collecting all the doctors in one platform. So many of the needy can get help. Really appreciable.
Well, thank you so much. I do want to say that is not possible without your support. We bring the best doctors from all over the world who have had successful outcomes. It's very important for us. So we build the trust, and then all the users can benefit from the therapies that are available that are natural. So with that, I want to thank all of you viewing this session. Please help us spread the word, share our, we really appreciate that. With this, thank you so much. Signing off. Thank you, Dr. Sneha.
Yeah, thank you, Amita. Thank you very much.
Thank you so much. Bye-bye.